Good evening. Welcome to the Dr. Theo Show. All right. Got a guest with us here this evening. This is Joshua Lippincott, and I was put in touch with Joshua through some mutual friends here in Greenville, but don't know a whole lot about what we're going to talk about, but we'll just have an open conversation. I've been trying to reach out to a lot of talented individuals with different political spectrum, different ideologies, different engagements to try to get the best quality information as unbiased as possible to my local community, because I'm concerned about my community. I'm not panicked, but I'm trying to get high quality information so that people can be as prepared as possible. So Joshua, thanks for coming on my show. And if you can introduce yourself and tell us a little bit about you.
Well, Dr. Hensley, thank you so kindly. I'm honored to be here, and hello, Greenville. Hello, Greene County. It's great to see you all. My name is Joshua Lippincott. I am currently a registered nurse from the state of California, but most recently, a month ago, I left what I felt was a very comfortable moment in time, because of course, very similarly, things weren't happening a whole lot in our hospital, and left it all to hop on the front lines in New York City. So currently I am serving with New York City Health and Hospitals at the Metropolitan Hospital on the border of the Upper East Side and Harlem. It is the county city hospital conglomerate, the largest in the state. And I have the privilege of working in the ICU and getting to love and serve this amazing community, all the while working through emotions, heartache, joys, sadness, as I get to see firsthand what ultimately has been this season for all of us of COVID, the virus, the talk, and the implications of what it's causing. So I'm very honored to be a registered nurse and healthcare provider and on the front lines being able to serve at this time.
Oh, no, absolutely, Joshua. And I thank you for everything you're doing up there. I get to sit in the comfort of right now my basement or otherwise my office. And of course, I'm wondering, is this person with the cough, is this the sniffles? Because we're in the midst of allergy season here in East Tennessee. Or are they pre-symptomatic and then going to be coughing from allergies and a postnasal drip? And then maybe I catch this like my colleagues have. But here you are in the middle of essentially ground zero, for without a better term, there in New York City. And what I've been referring to as a war zone. Now, we'll talk a little bit about that, because I mean, what a great opportunity having you and getting your perspective here. So for anybody listening, Joshua mentioned the ICU, that's intensive care. So essentially, you're dealing with the sickest of the sick patients, brink of death, a lot of people dying, I'm assuming just from my own previous training and experience in intensive care as a family physician, but also just the general chaos and everything. So really would love to hear kind of your perspective, what you guys are seeing, and maybe between the time when you were first there, how you were treating patients, what medications were being used versus what we're doing now. Because what I'm hearing is protocols are constantly changing, what we're doing, not only with potential medications, but blood clot prophylaxis to try to prevent this terrible clotting cascade and everything else. Just what are thoughts? What are you seeing up there?
Yeah, so it's really interesting. We'll begin even a little bit prior to that. I was expecting the San Francisco Bay Area to be an epicenter of COVID, just the spread of this virus. I mean, ultimately, when I was working within the Oakland and San Francisco Bay Area, we had originally the Grand Princess cruise ship docked outside our hospital, and we were having individuals from that cruise ship brought into our hospital as COVID rule-outs, as we were also transferring to Travis Air Force Base. So we were very much at that very beginning times of what are we going to do to respond to this? And it just so happens California locked down quick, and lo and behold, there were no cases, or were there. I would tend to say that I don't think we actually had a true flu season. I think the coronavirus is here. We just didn't know how to identify it. So what did that mean for me? Elective surgeries were done. My med surg floor was closed. So I decided to come out and hit the ground running here in New York City. Upon arrival, the Metropolitan Hospital, for a very long time, being a government-run facility, had many wings of their hospital closed. Well, in light of just the rise in the COVID cases, we were first put in the PACU, which is the post-surgical wing of the hospital. They made it a makeshift ICU. Now, a couple things that happened with that. we had to actually sign a consent to enter into this room. Part of that is because we had 7 patients, all COVID positive. And what they have been doing as protocol has been putting in the isolation or anti-air rooms, similar to tuberculosis. Well, this was one giant room. There was no filtration system. We couldn't open windows. So we were in our PPE gowns. So we were fully gowned. We were fully masked. We were fully N95 all day long, working with patients in an open room with basically COVID air, ventilators, high flow oxygenation, CPAP machines going all around us. So essentially, we were in what would basically be the fog of COVID. At that time, of course, it was the early on protocols. We were very much seeing the introduction of antivirals, but at that time, it was still hydrochloroquine, it was still zinc, it was still erythromycin, as just attempting to do whatever they could to be able to offset that. Another protocol, of course, that implemented, which I feel was highly effective, was proning. So it's taking a patient from their backside and while ventilations and tubes and everything coming out of them, flipping them on their stomach so basically their lungs had the opportunity to advance and expand on their own without the pressure. And we saw amazing results from that.
However, I heard the exact same kind of stuff from Dr. Ken Nickel, who I interviewed back a few weeks ago. Once again, local Army doc here from Greenville that was working just outside of where you are in Connecticut. And that's exactly what he was saying was you're doing this protocol, but turning people over on their stomach to allow gravity to get rid of these secretions. I mean, how simple is that, but also how effective, and there's no risk from that as opposed to medication. So that's interesting to hear it from you too. Obviously, there must be something to that.
Very much so. Well, and even beyond the secretions, doctor, I mean, the aspect of it, again, is lying on the stomach and allowing the lungs to expand. We know originally that the first diagnosis is it essentially attacks the pulmonary cells and that allow the lungs to expand. It stiffens them. And the problem, what we were finding is, of course, immediately when ultimately too late, they were being put on ventilations, tubes going down their throat, and the overexpansion was actually creating fibers in there as well. So essentially, it's like overinflating a balloon. Your balloon getting overexpanded and never having that elasticity to be able to come back again. What we were honestly doing by proning them, being on the ventilator, we were overexpanding the lungs and we were giving them an opportunity for also their healthy cells to continue to work to build up a resistance so that their body ultimately could also build their own immune response for the parts that weren't being affected yet. So we were trying to give them the fighting chance as much as possible. I would love to tell you that in the time that we were there, we had 100% success cases. There were many days in which we stood and we cried at bedside as we had to watch our patients gasp for air. There was many days in which we had to call loved ones and with an attempt of an iPhone, tried to give them the opportunity to say their last goodbyes and having to watch their patients' faces fill with fluids and eyes bulge. And ultimately, as we removed off the ventilator, because they would want to see them gasping because they were no longer able to breathe on their own and they were just so desperately wanting to take another breath, which I can't even imagine myself, but standing there holding their hands, doing everything you can just to love them in their final moments of this life. Watching someone from one day being extubated and thinking they're doing great to taking a look at their chest x-rays and watching this virus do an infiltration that all of a sudden takes over, knowing no kindness to any person, and in 2 days, them passing from this earth yet again. It's hard. It's something in which I don't think I've fully processed yet. It is a very real thing. At the same time though, every single day we stand and we listen to our speaker that's in there, because Don't Stop Believing by Journey plays when a patient is extubated. It then plays the full song when they walk out of the hospital. And it's one of those moments where you hear a lullaby when life is born, when you hear that song, Life is Given Again, and you just stop. It literally stops and we just cry because that is the hope that we still have, that we still can overcome. But unfortunately, the percentage of overcoming is a lot lower than those that are not. So
great transition there. Here you're talking about this kind of end stage of life, and it's been a few years since I've been there, but I also carry around some of that emotional burden when you have a person. Yes, maybe some are old, but some are not old. I mean, I have taken care of 34-year-old mothers that I have on 5 vasopressors to maintain a perfusion of organs, and between the widespread infection or whatever that I've been dealing with even in years past, that you develop the acute respiratory distress syndrome, or ARDS, which is everything I'm hearing is showing that that's something that's just comes from the virus, but then also when you add on the ventilator and you end up going up on PEEP and all the other barotrauma that can come across from that then it's even something more common that you're seeing. And I remember feeling so helpless that no matter what medications I had, no matter the perfect settings, the interventions and from the full medical team, that here's this young, healthy person that I can't save even with modern medicine, incredibly heartbreaking. And I want to just take a quick moment there to highlight the humanism that you just kind of displayed there. Almost teared up a little bit myself, to be honest with you, depending on the lighting, right? But I feel like us doctors, nurses, other members of the medical team, due to a whole lot of circumstances, burnout, stressful jobs, having patients throwing things at you or cursing you or slamming or spitting or whatever else it is, that there's a huge emotional burnout in medicine as it is. But when you break down the core of almost all of us that got into this profession, it's still an extreme desire to help people. And yes, we don't realize we can save everyone, but even if we're frustrated, even if we're having a bad day, it's that core where you don't get into nursing, you don't get into being a physician, you don't get into that job for money or for fame or prestige or anything else like that. It's because you have a calling to help your fellow man or woman in those types of walks of life.
Well, and I love that, what you just say there, doctor, because I'm ultimately at the end, for me personally, as my own personal faith and recognizing patients come in their own views and how they want things. The fact that I want to take the opportunity to hold their hand and say a prayer over them. I want to, when I know that the patient is going to pass, we purposely made time that we would just wash their hair and comb it and lotion up their bodies and not just see them as a diagnosis or a failing body. It's a life, and it's a name, and it's a person. And when you're FaceTiming, you realize that that's my grandma, that's my sister, that's my brother, that's a cousin or my neighbor who I may never taken the time to interact with, and now I'm not going to, because here they are, and for whatever reason, why was I spared and them not? But it's the reality of what it is. But it's not losing that heart of, like you said, not even just the humanism, just recognizing that is a human life with purpose, and this is their time. But at the same time, though, how hard, and at the same time, what an honor it is to be there. But it's just unfortunate due to, unfortunately, the retribution of this terrible virus that is just wreaking havoc.
So here you are, you're holding their hands, you're emotionally distraught, but like you mentioned, still in the war zone. So not really that time to process this. Now, I've read the stories, I've seen the pictures of the mobile hospitals set up and the Mercy ship there. And here I'm thinking this as a civilian saying, holy cow, this is a war. And of course, you mentioned these last moments in cases, or the joy when someone leaves, but there they are, in those scariest of moments, and their family is not able to be with them. They're not able to hold that hand. I mean, how terrifying is that? But also, what a blessing for you and your team to show that kind of compassion. And I think that's a story, if there's anything to highlight, of, yes, we may talk about treatments, we may talk about the seriousness of this or the preparedness or other types of things. But essentially, there's a large group of people that genuinely care about the health of our neighbors, of our grandmothers or brothers and sisters. And I'm not sure about you, but I have zero conflicts of interest here. I'm recommending a vaccine that doesn't yet exist, and we don't know how effective it is, because I'm hopeful that we can get back to some semblance of a normal type of life, hopefully by this time next year. Now, I'm not suggesting, once again, we don't live life in our rural community and work while numbers are low, but that we have to be vigilant, and so one perspective I wanted to be sure to get from you was, how do I convince rural East Tennessee that A, this is real and not a hoax, and B, how to prepare for that? Because a month ago here locally, we didn't have the testing capabilities and capacity that we do now. So I had no idea who may have this or not. Right now, we're looking at roughly a 69% testing rate of someone who has the virus and tests positive. But we're missing perhaps a 1/3 of the people out there from just the imperfection of the tests. But how do I convince rural Greene County that this is serious? And just for complete clarification and transparency, I want to remind people, I'm a conservative physician, somewhat in the libertarian range as far as freedoms and don't tread on me kind of stuff, right? But I'm overall fairly conservative, mostly conservative as far as voting and things like that. What I'm seeing from people is so much politicalization from the far right, from the far left. I have this hunch, and I've come up with conspiracy theory myself, that a lot of this stuff is coming from the Chinese and the Russians to try to divide us and to try to break us down, because why not destroy America internally, right? Now, I have no basis for that, which is why it's a conspiracy theory. I have no scientific basis, but I think there's groups of people that are trying to tear us down. And right now, in social media and online and YouTube videos, you can have thousands of videos, just like the one we're doing right now, of compassionate, caring healthcare professionals saying, wash your hands, cough into your elbow, and wait for the experts to figure this out and get a vaccine when it's available. And this is a big deal. But this video won't go viral. But all it takes is 2 doctors or a chiropractor or some other whack job selling snake oil that says something just absolutely absurd, not based on any facts, but they want to believe it. Or this insane notion that Bill Gates is going to inject microchips in a vaccine. I mean, this is absurd. I mean, this is the stuff I'm dealing with right here. Now, I'm not naive to too much to where I'm saying I know everything. In fact, I'm here usually on my show saying, hey, here's how much I don't know. I'm not saying I know everything, but I feel like I know how much I don't know. Now, what would you say to that as far as how can I not only convince people, hey, this is real and is serious, but also how to not let up on the gas? Because we have very few cases here locally over the past week or so. People are saying, oh, we've overreacted. What are your thoughts there?
So first and foremost, I am not going to tell anyone what to do. I think that's been part of the problem of because I think the choices that we're getting to make right now isn't based upon a realistic perspective and information presented. It's sensationalism. It's politicized. It's even in our own internal gut of us having to decipher. So let me put it this way. First and foremost, is coronavirus real? Yes. Hands down, it's real. And I'm so grateful that Greene County, East Tennessee has not seen what I have had to see. And I'm talking for a 35-year-old that I watched pass the other day, to a 68-year-old who passed the other day. I intubated a 50-year-old on pressors who is not going to probably make it. I have seen it, again, a range of and now we're talking children, the manifestation of symptoms in children potentially because it's affecting them differently. It is real. That is just a fact. So what do we now do with that? At the end of the day, what I always ask myself for anything that I do, healthcare professional in life, is what is my motivation in my heart? Why? What is the why behind why I do it? Is my why because I want to prove a point and I have a right to do it? Well, maybe, but again, I would tend to question, and usually that's a pretty selfish motivation. It's me having to prove something. What I want to ask even during this time is, what is my responsibility, kind of what you're talking about, that I can do that recognizes what the realities of what we're facing here? First and foremost, it's not that big a deal to wash your hands, so wash your hands. If you have to go out, wear a mask. And again, other ones like, I'm being muzzled. The government is telling me to do this. They're taking away my, okay, I can find an excuse to fight many and multiple things. My parents for a very long time told me not to do things. But when I listened to what they had to say, it was because part of it was they cared not only for me, but for others around me. And so it was a responsibility of me just taking a step back going, is it really that big a deal? And how is this going to affect others, including myself? And is it really at a loss at the end of the day? And I will tell you it's not. But here's the quandary we sit with now. We're at a point now that cases are somewhat diminishing. We are talking about in the latter part of the year to the beginning of the year, a second surge potentially. And as we've talked, there's been a lot of theory in this. I think first and foremost, I would want to look back over history. And I think part of it is, I think we as a society have grown complacent because we haven't faced hard times in the most recent of times. And if we don't look back about how things come back in cycles, I think one, it's naivety, but it's also insanity. There was the Spanish flu that had a research later on that we're comparing this to where it has the potential to do that. Our flu season every year gradually gets worse when we can't identify the specific strands that are going to be out. So we see a surge in deaths of flu. Viruses act this way. So why not understand that and try to be proactive in how we respond with that?
You know, absolutely. I shared a graph, I think last week, and it hasn't been updated yet this week, but I plan on continuing sharing that graph. And what it is looking at the CDC numbers for all-cause mortality, okay? And that includes every heart attack, every cancer, every stroke, every flu death. How many raw people are dying in this country every day, right? And you go through those numbers and you add them up, and you know, it's pretty predictable. Every year there's fewer deaths in the summer and more deaths in the winter. You know, and it's not a huge amount, but you can point towards, you know, flu and pneumonia and, you know, suicide or other kind of causes where there's traditionally more. And so when you look at that over the past few years, and this is taking out all politicalization of this. This is raw numbers of deaths. I mean, you can't spin those numbers. And what that shows is, you know, back in 2017 to 2018, the last worst flu season that we've had, at least in a few years, there was a decent amount more deaths than what were expected. And sure enough, by the end of the season, and this, I'm talking about a 6-month flu season, not a 2-month or 1 month, what we're dealing with right now, but over the course of 6 to 7 months, around 60, maybe up to 80,000 people died from flu that year. And the overall case to mortality puts that at around 0.1 to 0.2, which means 1 out of 1,000 roughly people die from the flu, sometimes 2 out of 1,000 in a worse year. But that's the general numbers, and it's pretty predictable. And occasionally you have a little bit of an increase of a blip. But once again, by April, May, those deaths are starting to decrease back towards the summer numbers. And what we see clearly, you can go to the CDC website right now. I'll share it again here soon. But what you see is beginning of April into May, a marked increase in deaths, way above what's even remotely expected. It's not typical for this time of year. And so that really means 2 things to me. One, we're having this real virus that's killing people, and you're telling me, yes, I'm seeing people that don't typically die from this, and we have witnesses like yourself saying that. The only other possibility for this would be that people are so scared of the virus that they're not going to their doctors when they're sick, or they're not going into the hospital when they're having a heart attack or stroke. And I'm seeing some of that, and I'm starting to get concerned about that, because I have people that are having symptoms that think, well, this could be a pulmonary emboli, this could be cancer, you could be having a heart attack, and they want me to send in antibiotics over the phone. And I say, listen, I'll do that, but you need to be seen. You could die because of your fear. So that's really the only 2 things that I can see are possible to cause this spike. And we have a known confirmation of the other. And I've seen some incidences, not of death, but of people putting things off that are serious, that will cause those, and those would be inadvertent deaths. Now, we don't know yet if after this initial spike, is there going to be a dramatic drop in all-cause deaths for a while, and maybe a decent amount of those are people close to end of life, barely hanging on. We know there's some of that, but we also know there are younger people that should be living another 20 or 30 or 40 years that aren't. Now, there's always some of that in flu season. We always hear of a rare case of a 30-year-old lawyer or someone who dies from flu. And of course, people don't take that seriously. But what do you think? Do you think this is more serious than flu?
Yes. So here's the thing at the day. I think you're going, I'm going to go back to something in which you hit on that. I love your perspective of automatically starting this. It's unknown. And I think this is the hardest part about what we're dealing with right now. We watch the trends of the flu, and we make vaccines. We do all these because we know a response. We know some form of routine to be able to respond to what it is. Maybe the death is due to heart attacks, maybe this. but we're still making a presumption. And at the end of the day, when we look at the coronavirus, the reason why it was called novel, it's the manifestation of the fact that it has an incubation of potentially 2 weeks before signs and symptoms that you're contagious and people are staying in. Even beyond even what you asked me earlier, that we're no longer just seeing respiratory, but it's the virus attacking the ACE receptors, which is all throughout your arteries and veins where they're creating clots. And those clots are being, so where you are dying not from the virus per se, but the effects of it, because you're getting pulmonary embolism, you're having a stroke, you're having a heart attack because these clots, because the overreaction of the body is throwing these things and your body is shutting down because it no longer can properly function. It comes back to, again, where the hardest part is because we don't know. I think in our naivety, we want to push, and we want to have an answer, and we should have an answer. And it goes back to even what we said earlier, the political side of things. The economy needs to open. Oh, we need to protect ourselves. We have these warring entities, and it's not warring entities because we want what's best for the people. It's an agenda to show this is what we've done. This is what we're doing. And really at the end, I'm like, but when does it return back to what we need to do, what's best for us, the people?
And that's such a tough, interaction, like you mentioned. How much do you overstep freedoms for the sake of safety, and then when do you turn the faucet back on to get the economy going? Because that's a big deal. I know for people locally, there's potential, a lot of people losing their jobs and health insurance, and that has downstream consequences. So this isn't as simple. I mean, people are making this out as black and white. No, the truth is always in the middle. And my question to people is, okay, nobody learned from what China's experience was because they just weren't really that truthful. Their government's completely shut down. They have not a free press. They silence people who say things or whatever else, and not getting into conspiracies, but it's not a trusted source. So when we saw Italy get overrun with 8 to 10% mortality, even though an older population, Italy was previously ranked the #2 healthcare organization or country in the entire world, and they got overwhelmed. So that's when I got, hey, we need to pay attention to this. Hey, we need to take this seriously. And by then, it's already hit New York, or it's already hit those, and you've got 2 million people living there and 4 million commuting, or whatever that is, in subway cars and airplanes. And what an obvious but terrible breeding ground for a virus like this. So my question, at least to my Greene County neighbors, is, okay, New York didn't learn from Italy. Italy couldn't learn from China. Are we going to learn from New York? And I can't do anything about Knoxville and Nashville and Miami or anywhere else like that. I'm only one person. You're only one person. And that's why I appreciate you taking your time here this evening to talk about this, because I feel like these are the conversations we need to have. Now, I would love to look back a year from now and say, holy cow, how much time did I waste in my basement talking to people about this? And this wasn't nearly as bad as they predicted. I would love that. I would love to be wrong. I would love for this to be a conspiracy theory and some kind of deep state agenda, which is, I think, completely bogus, but I would love for that to be true. I don't think it is, because of a significant amount of current science and high quality information and everything else. But yes, there are still a lot of unknowns. So I'm in a weird predicament that's interesting to me, because I hate being wrong. I mean, all my life, hate being wrong, just like the young child type of example we were talking about earlier. You want to rebel against your parents that tell you not to do something because I'm right. And my 18-year-old self is this, I'm never going to get old. Nothing bad is ever going to happen. Cancer and heart attacks just happen to other people, not me. I'm going to live for forever. And I feel like that's a mentality that even as we hit our 20s and 30s and 50s, for that matter, it's not going to happen to me. It's not going to happen here until it does. And so that's what I'm hoping is, how can I convince people to wear masks? Because like I said, it's not 100% of how helpful they are. We think right now that protects if I cough or spit when I talk or sneeze from spreading droplets out. We don't know how much it's going to help, but the best scientific consensus from the smartest people in our country say it's a good idea. And so, like you said, why not? And I don't think there's any evidence of saying that this makes us sicker or is bad for our immune system or other kind of things that are out there. But how frustrating is that of you saying, hey, people are dying, and yeah, it's old or frail, but it's young and everything else like that. And here I'm banging my head against the wall, trying to show people what I feel like is common sense. So I really appreciate your perspective. Any last thoughts as we're wrapping up?
Yeah, so we'll end on a couple things, Doctor. So number one, please don't make this out to be a conspiracy or political agenda. And at the end of the day, here's the thing. I hope we're wrong as well, but what if we're not? And at the end of the day, one of my fears as a healthcare professional right now is watching what's happened in New York and the healthcare system being stretched so thin. If that happened across all 50 states in the world, the death and the detriment of loss that we would face would be astronomical, that we could never take back again. And so my question would be, is you having the right to go do this, or to have everything open or go back to normalcy, and is it worth it? Is it truly worth it? But at the same time, though, what I also want to ask is, I want to recognize you're right. People need healthcare. They need their jobs. Kids want to go back to school. Okay. But what I would ask you is, so just because Walmart opens up again, does that mean everyone in the city, because it's the grand opening again, needs to show up on the same day at the same time because they're right to be there? No, it's that overreaction to where I want us to think responsibly of how we take necessary steps to, again, value one another. And that maybe I need to take a few steps. Maybe I'm not going to be able to go to the gym. Maybe I can't go to a movie theater again, but maybe I will have a gathering with friends where I can have 10. Well, I should be able to have all of them. Is it still worth it? Why we don't know right now? Because if you say it is, then do it. But if you say it isn't, because if we happen to be right just slightly, by you holding back and recognizing that it is real, the coronavirus is causing this effect, that you can hold back, that if we do have a surge again, you've done your part, that Greene County happens to be, once again, an area that gets to be dismissed because they did everything right. I'm going to be so thankful. But if you're wrong, it's going to break my heart, because as a healthcare professional, I'm going to be flipping your loved ones. I'm going to be holding their hands, and I'm going to watch them gasp for air. And you know what? All I'm going to be able to do is offer you a phone, and that will be the saddest day of my life as a healthcare, because as you, I can't fix it. All I can do is be present and praying to the dear Lord that this passes quickly, because it breaks my heart every single day.
And same here. And I agree with you almost every single point. And to be clear for anyone watching, we haven't discussed these things. This is our first time Joshua and I have really ever talked. We talked for a few minutes just as far as like how to plan this interview, general things, but this is all wide open. So I didn't know what I was going to expect there too, but absolutely. And what also concerns me that we haven't mentioned yet, but also here you are putting your life at risk. And when you look at people with highest exposure, you've got dentists, you've got anesthesiologists and CRNAs, you have ear, nose, and throat doctors, and just like yourself, ICU nurses, people that are responding to codes or intubations or self-extubations or coughing and all those types of things, which are incredibly high risk, all while concerns about access to protective equipment and having to reuse these masks that typically we're told to throw away, and trying to be creative and all that. How terrifying that is. Now, have you seen doctors or nurses or allied health professionals come down with this and be really sick or die, or are most people recovering, or how is that looking?
Yeah, so within our conglomerate, we've had a handful of individuals test positive. They went on quarantine. We've had, I don't know of any deaths within our hospital per se. Yeah. Part of it is, especially with the healthcare professionals, we obviously dealing with this, we know how to immediately respond. We self-prone ourselves before doing anything. We start doing things because we know if we're proactive in this, we immediately will hop on the medications. We're not waiting to the last minute. We're like, what is going to get tested? What do I need to do? But we've seen the full gamut of those who are asymptomatic to those very much where they're describing hallucinations and high fevers and coughs and not breathing and almost feeling as an out of body and panics and losing. I mean, we've seen all those within our hospital conglomerate. So it's there. But the idea is, again, I think part of it goes back to, because there's a basis of knowledge and what we're dealing with every day, and because we see it, our proactiveness to respond to that is good. My fear is when those don't have the knowledge, or they're fearful, or like you said, they have a cough, they have this, and now it's manifesting other things. And then when they arrive, it's too late. There's nothing that we can do. And that's the hard part. So yes, but like you said, I appreciate also you offering up that we're in it. And I am not a hero. And I say that because as a responsible one for the oath that I committed, I want to be in those codes. I want to be in their faces because I am willing to do whatever it takes to save your life. But it does put all of us there at greater risk of exposure. And because of that, our biggest thing is if we can have less people that we're exposing ourselves to, we're forever grateful, because at the end of the day, we want everyone to have a chance, including ourselves.
And that's what I'm pushing 100% here on our end too. I heard of a nurse responding to a code, I think a few weeks ago, didn't have an N95, just had a surgical mask on. A lot of secretions and other things that happen in that chaotic situation, which I've been there on plenty myself. And 2 weeks later, that nurse ended up dying from coronavirus. And one of the thoughts is just that high viral load and a close exposure, and then it's that much quicker or overwhelming of an infection just from that. But I disagree with you, Joshua. I think that you are a hero, and maybe that's things that you don't realize until afterwards when you're processing it, you're looking back and you say, you know what? Yeah, I could have died from that, but I didn't. And I hope that you are safe and you take those proper precautions and that you get through this as well. And I'll pray for you through that too. But yeah, no, I think that you as a healthcare on the front line in the worst type of battle zone as you are, I liken that to being military. Now, I don't have any military experience, and I appreciate greatly the men and women that go and bullets literally are flying. But when I talked with Dr. Nickel, who's Army, we talked about that and a few other guests that I've had. And one common thing is saying, well, this actually is a war. You just can't see the enemy and you can't see the bullets. It's invisible, but it's there. And I'm hoping, once again, that we're wrong and that there's not a second wave or a third wave from this. I'm hoping we get back towards normality. I think some of that's going to be herd immunity, which will take a vaccine, but it's going to be really challenging to get an effective vaccine just with the genomic RNA sequencing of the virus. And if herd immunity gets up towards 60 to 70%, either through that or through the less desirable people going through what you're going through, then I think finally things will be back to normal. Now, I'm telling my followers that you'll know things are back to normal when I grow my full beard out. You may not realize this, but for 20 years I've had a beard, and I shaved mine and went to mustache to be able to so I'm telling people, when you see me with a beard, it's over. Maybe, but probably.
Yeah. Well, I'm right there with you. I feel very naked. I usually have a beard as well. I mean, this is enough scrub because I've had a couple days off, but I got to get that mask feel. So I completely understand.
Absolutely. So I look forward to today when maybe a year from now I can have you back on and we're both bearded out and we put a picture of this and be like, oh, wow, look how goofy we looked. But, I love my beard, but I love my patients and my family more. Joshua, thank you very, very much for your time. And if you have any other information that comes up or anything you say, hey, this would be important, be sure to let me know.
Well, Dr. Ramsey, I truly am honored. And for all of your viewers, again, anytime on social media or even connections, if they have any further questions, concern, that they really just like, what is it like? I'm always willing to share, not because I have anything important to say. I just want to be able to offer the most real perspective. And I truly am honored that you would just take the time to allow me to share this. And I thank you ever so kindly for all that you do as well. Thank you so much.
I'm hopeful that this 45 minutes that we've invested here, because I call it an investment, like we're planting seeds, will pay off. And if one life is saved, I think it's worth it. All right.
Absolutely. You too. God bless you guys. Take care.